heading out to Sammamish. We are going to do a home visit with an elderly couple to check in on them and see if they need any other resources and how they're doing after a couple recent falls.
I feel like I could pass out.
The reason a lot of people are calling 911 is because they're not able to get the care they need. So the emergency service system is sort of filling that gap.
The last thing I want to do is be a burden.
CORE is the Mobile Integrated Healthcare Program. We started with a partnership with the Issaquah Food and Clothing Bank. Issaquah Food and Clothing Bank provided a social worker, and we provided a firefighter. And what we do is refer all the patients that we respond to, or 911 callers that we respond to, that don't necessarily need medical attention. They identify some kind of social or behavioral issue that they need help with. They then refer them to our CORE program.
I think it's innate in every firefighter to be there for somebody else, and oftentimes there's not an easy fix.
Because it's hard to access, it's hard to ask for help. If you've never had to do something before, how do you do it? Where do you start?
We'll always be here for you.
What we see a lot of is people who have maybe never needed to access services or access help before, and our medical system and social services system are very confusing.
No matter what it is, we can connect them with the service and help them through this path. Rather than get into an endless cycle of calling 911, we can help connect them to a service that'll really make a meaningful difference.
It's designed to provide the different solutions, and that's what makes it such a good partnership between firefighters and the CORE program.
I think being able to help guide people through that process, it's nice for us to be able to do that, and it's also, I think, a really important service. We like to think of ourselves as the entry point and the connector to a lot of these services.
Better than Home Depot.